Uh, Thanks for joining us today. We're going to be talking about GLP-1s, the new era of weight loss medication. I've created a partnership with BioCoach and Durrell Finch. Sorry about that. And we're just going to break it down for you. From my point of view, I'm advising employers on managing their healthcare budget, and I like to say
Mhm.
that health insurance budget. And I see this as a big future cost. And to really be proactive is Darrell is going to add some light to it or some color to it in terms of what we can expect. So on that note, my biggest concern is who's going to qualify? What are the side effects of this drug? How long are employees going to be on this? And whether or not it's going to be covered in employers' health insurance plan designs. So just take us from the beginning and just share a little bit about why are we talking about this drug?
Yeah. So first off, thanks for having me, Ken. You're talking about this drug because these drugs will, and the management of these drugs will fundamentally change how healthcare and health spend is administered. Yeah, they're just so expensive. So I have a slideshow for you, but you might have heard a lot about these drugs from the news, the internet. You might be hearing or receiving pressure even now from employees about it. And here's why. So 90% of employees feel that these obesity medications should be covered by the employer, right? And you have half of that, or half of the employee population saying that they would leave jobs to find a job that covers these medications. The best example I got about how these medications, why they're um, so popular, is because people see them, they attribute them to someone who has the weight to lose will attribute this to the equivalent of getting a new Porsche as like a new higher benefit. Like imagine getting a new Porsche as a new higher benefit for joining your company. And imagine the feeling you would have driving that Porsche around town, stopping at stoplights, getting into it, and having your friends see that car and being like, wow, oh my gosh, you're awesome. You must be living life. You must be successful. Well, that's exactly how people see this medication. People don't really feel comfortable in their bodies. Right now, the national populace, 60% of the population is diabetic or obese. 60%. So you have a lot of people walking around in bodies that they might not feel the best about. So to them, this drug is the opportunity for them to have that body or that Porsche they've always wanted, right? So you have famous people like the Kardashians taking the drug. You have athletes like Charles Barkley taking the drug. You have personalities like Oprah coming out and saying that, hey, diet and exercise, willpower isn't actually the recipe. It's these medications. Sorry about it. So you have a lot of people being told what the benefits of the drug, quote unquote, and also that willpower is no longer the driver for results. It's medication, and that's why you might be experiencing the rate of the rate of feedback you're getting at the HR level because this is what your employees are seeing everywhere they go. So I think that's an important distinction.
That is, it's also, in my opinion, that's scary, and I think that's what we do in America. Let's say is we have a problem and we want to know what drug can we take to fix it.
Right.
Um, I like to think that the communication process or education process is going to take a few years before we start to see, well, what are the side effects of someone on this drug? How long are they going to stay on the drug? What happens when they come off? If they're
Sure.
losing dramatic amounts of weight, what else are they losing? And I know you alluded to it before, we spoke about it, but you're not just losing fat, you're losing muscle mass. Do you have proper care management are all the questions that run through my mind. But just skipping those points and just going right, my concern is my job is to educate and advise employers.
Yeah.
So I think you had on the next slide there just on the cost. So we're expecting huge increases in the cost.
Yeah. So,
And I was,
okay.
yep.
Cost and then rate of coverage. So just like I told you before, there are people that see these drugs the same way people see Porsches. So the amount of employers covering this drug is expected to double this year alone. And the scary part about this, and the reason why I think what would differentiate a good advisor from one who might just be kind of going through the motions, is how they advise you here. Because 55 to 60% of your population qualifies for a drug that costs $900 to $1,200, with the use case, the clinical use case for this drug being life. So clinically, they're not told they have to come off this drug that costs this much money, right? So as a advisor, you have to figure out how do I manage this storm if everyone wants a Porsche and that Porsche is $1,300, right? Your health spend is going to blow up, and that's in a fully funded environment and a self-funded environment. It doesn't matter. At least in a self-funded environment, you have more visibility. So you might be able to say, okay, based on claims last year, but in fully funded, it's just premiums. So your premiums are going to go up, and you're not going to really understand or have too much feedback as to why, unless you request it specifically. But yeah, so I think this will be a battleground where brokers are either hired or fired, in my opinion, because it is too costly of a mistake if you make a mistake here. And right now, what I've seen, there's a lot of brokers that don't have, or advisors that aren't really educated on this. They don't have a plan for this. They're not thinking about management, vendors like us who come in and manage this. Their one kind of solution is not to cover it. But as I mentioned, if as an organization you're not covering this, you might lose really good talent and not actually be able to attract new talent. You might lose qualified talent you already have and not be able to attract any other talent because you don't offer this medication and the company down the road does. So just not offering it is not going to be an adequate solution here pretty soon.
So I'm assuming that's probably going to be the easiest route, and employers are going to say, no, we're not going to offer it. But let's talk about when it is offered.
Yeah.
What is the authorization process? How does someone apply, or let's say voice their need to want this drug? Like, what do they have to go through to actually get it, and what qualifies them?
So I will tell you the process as it stands right now, just to give people some context. As it stands right now, clinically, you have to, for weight loss, you have to have a BMI of, so body mass index, of 27 with 2 comorbidities, or a flat 30 BMI. So right now on this call, I stand 6'6". My mass is, I'm about 230. My BMI is 27.8. I had a trip last week to Puerto Rico. If I wanted these medications, clinically, I qualify for it. I can go to my provider. I have one comorbidity. I have asthma. So I can go to my provider, get my script, have my $1,300 designer drug, get that, get visibility in my abs just in time for my vacation. Now, the drug doesn't work that way. Like, I'm not going to be able to take one shot and day 2 see my abs, but your employees don't know that. I said your employees don't know that that's not the case. They don't even know how these drugs affect them. So you can't even use logic here necessarily. But right now, as it stands, like I said, 27 BMI. I'm 27. LeBron James is 28. And I also told you 60% of the population is pre-diabetic or type 2 diabetic, which all those, the underlier is obesity. So you get your script, you go to the doctor. I sit down in front of my provider. I say, hey, I'm thinking about weight loss drugs. The provider takes my BMI, sees I qualify. They find 2 comorbidities to add to that. And then they write me a prescription, because they get a kickback from the pharmaceutical company the more scripts they write as well. So they write me a prescription. I go as the patient to my pharmacy and I get my medication. I have my Ozempic, or I'm sorry, Wegovy for weight loss. I got it. Now
Mm.
it has directions. I take it according to my directions, and I wait to get skinny. Right. So that process leaves out so much. No one's told me side effects. No one is there to kind of guide me and tell me what I should be eating and how that correlates to muscle loss and why muscle is important. There's none of that. But in our process, it's a little different. So we will raise the BMI standards, and that's typically what most advisors will do also, is just raise the standards, which is a nice frontline defense. I will say that. But after that, you need, for the people who do qualify for the program, we've also seen that on average, it's about 4 to 6 months before someone on the drug by themselves quits the drug. And you can't afford someone to start, stop as well, because you're only covering the drug for people to get better, not for the sake of covering the drug. So if you are starting and stopping, there's no kind of straight path to remission because you're not on the drug even long enough. So in our program, in order to receive medication, along with other prior authorizations that we have in place, I can only give you the info. I can't give you the full recipe. But once you're in the program, you have to be using the BioCoach program to receive medication. And the thinking is, as the employer, if you're going to offer a drug that costs $900 to $1,300 a month for life, you are expecting this person to be serious about weight loss. Because not to mention weight loss, a reduction in weight can be a remission in comorbidity or in side effects like heart disease, like hypertension, like diabetes, just a 5% in total mass reduction, where these drugs are scheduled to produce 15 to 20% total mass reduction. So the drugs are powerful and they work when used appropriately. And the problem is there's no one managing your patients or your employees on the appropriate method. So that's what we do. Our program's 12 months, and we have different checkpoints in there for them to be talking to the provider. Ideally, our program's adopted by a self-funded employer who has direct primary care attached. But again, talk to your advisor. If it's a good one, they might advise that. But yeah, so far we've seen great results, but everyone's kind of rolling out their programs now for weight loss. One thing to be wary of is anyone offering a lifestyle program that offers medication as well. The two cannot coexist. I can't be incentivized to give you more medication and be interested in you learning lifestyle therapies. It just doesn't work.
That makes sense. And I think that's very helpful in terms of what we're looking at in the future. Um, I'm a big believer in less is more, and so I don't want to go too deep, but I think this was a good start to begin these conversations. I'm sure it will be on the top of a lot of people's minds, employers and employees. I mean, I'm just out of pure curiosity, I'm interested. I mean, I'm very similar to what you said, and if I were to use BMI, I'd be a candidate too, and there's no way, and I wouldn't take it ever. When
Right.
I heard that I'm going to lose lean muscle, I mean, I worked so hard on just creating that. Um, that's not something for me. But again, I do those facts that I believe you said 60% of our working force or working Americans would have qualified for. I mean, that's a staggering number. Um,
Yeah.
so this is something that will be talked about and we'll continue to educate. And I really do appreciate your time today. It was educational for me, and I hope our audience feels the same way.
Happy to help.
Thanks, man.